it's bothering you enough, if it's inconvenient in your life, it's worth looking into, right? And even
Hmm.
if you've been told like, oh, this is normal, this is common, like get used to it, right? Like ask yourself, are you willing to stand for that? Like, are you willing to just settle for that to be, the rest of your life essentially? I'm Rachel, and you're listening to the Owning Your Sexual Self podcast. All right. Welcome to the show, Amanda. Thank you so much for coming on today.
Thank you for having me. Super excited to be here.
Yeah, absolutely. And so we're talking all things pelvic floor today. Tell us a little bit about you. It's the first time on the show. And again, thanks for coming. And I'd love to hear more about you.
Yeah, absolutely. So I am a pelvic floor physical therapist located in Chicago, and I have been treating pelvic health for about 4 years now. I initially did my physical therapy training in the UK. Actually, I received my master's there and started working in the NHS. So that was my first exposure to pelvic health with one of my rotations there. And prior to going to PT school, I actually didn't really know it was a specialty I could get into. So when I ended up moving back to the US, I got my doctorate from Northeastern University in 2021, and I started treating mostly orthopedics and athletes. I was working with a lot of runners. And then that year, I started working with a lot of pregnant and postpartum runners. And what got me into pelvic health as a provider was that I was referring out to it a lot, and I didn't know what was happening in those sessions.
Mhm.
So I initially took the weekend course just to gain a better understanding. And it was on that course that I had like a light bulb moment in my career. And I was like, whoa, this is what I've been wanting to do this whole time. This is the specialty I need to go into.
Mhm.
So from there, it was, it was a full send. I took multiple courses. I started treating pelvic health part-time and then full-time. And about 2 years ago in 2023, I opened my own practice
Hmm.
called the Pelvic Institute. We're in Chicago, and what prompted me to do that was mainly just I loved what I was able to do in orthopedics in gym settings with loading patients. I had the weight options I wanted to really progressively overload them and get them better. And in a lot of pelvic health practices, I wasn't seeing that. I wasn't seeing that equipment that I wanted to use or the capacity to also load patients in that way. It was more focused on breath work, and we'll get to that. Breath work is really important. But I just wanted to kind of create my own version of that where it blended my different specialties. So now we have 5 clinicians at the Pelvic Institute who all specialize in treating pelvic floor dysfunction, and I love it. Yeah, that's my physical therapy background.
Yeah, I love that. And yeah, so many clients that I'm working with, when I suggest pelvic floor PT, they're like, wait, what? That's a thing? Like so many people don't even know that it's a resource or all of the many things that pelvic floor PT can help with. And so I'd love to start with just, can you give us a general overview of pelvic floor? Like what is it? What does it do? What are the functions? Why is it so important to sexual health?
Hmm. Yeah, the pelvic floor is a group of muscles. It sits at the base of the pelvis, and everyone has a pelvic floor. Some people don't know that. So
Mhm.
everyone has a pelvic floor. This group of muscles, there's actually 14 of them that sit there together, and they have a variety of functions. And what we're focused on in pelvic floor therapy are really the supportive functions. So it kind of sits like a hammock and supports the abdominal contents. So that support is a big function of the pelvic floor. There's sexual function. So an orgasm, for example, is one large pelvic floor contraction or rhythmic contractions. So that sexual function is really important. We have maintaining continence. So in our patients, sometimes we'll see urgency, incontinence, or retention even. So that sphincteric function is part of the pelvic floor as well. And then we have circulatory functions as well included in that.
Yeah. And you mentioned like 1 in 4 women have a pelvic floor disorder. And why do you think that this is the issue? Like, why do you think that this is something that is so common, yet so many people don't know about it?
Yeah, I think pelvic floor disorder is something that's been really normalized. So we have this saying in pelvic floor therapy that just because it's common doesn't mean it's normal.
Mhm.
Because I, off the top of my head, can think of like 17 family events where one of my older generation women was like, oh, well, like after 50, you just start peeing yourself a little bit. And that is just a mindset that has been normalized so heavily. And then we also have, oh, well, like I have painful periods, and people aren't recognizing that that could be a symptom of endometriosis, which is something we treat in pelvic floor therapy. So there's a lot of these conditions that have been written off as something that women just experience. And that's why initially pelvic floor therapy was really focused on women's health. So now we stay away from that because we are gender inclusive, and it does apply to everyone. But a lot of these things impact women because this stuff has been pushed to the side or normalized over the years. And that's not even getting into sexual dysfunction. And sex is supposed to hurt for the first time. You're going to have a hard time achieving orgasm. You know, there's so many reasons why I think the number is that high, but I would love to see more solidified research on this. And that's another piece of working with women, is that there's not enough research on our bodies.
Mhm. Yeah. And I think it comes back to like these things are common, but not necessarily normal. And yeah, I think I think those family conversations that you're alluding to, like that can be helpful. And I think normalizing it, but also if it's, again, if it's not actually normal and if it is falling more in that common category, it's like, no, yeah, like I don't want it to be just okay that I'm peeing my pants when I sneeze, like that
Yeah.
doesn't, like I'm not settling for that essentially.
Yeah, we have a balance of destigmatizing but not normalizing. So it is okay that you're leaking. It is okay that you're experiencing this symptom, but it is something that can get better, and that's not something you have to live with.
Mhm.
So we don't want to make people feel that just because they're of a certain age or because they're postpartum, they have to live with this symptom.
Mhm. Yeah. And then that brings us, kind of leads us into the shame aspect of this, right? There's so much shame that women face around pelvic floor dysfunction and all these things that are going on. And so things like, urinary incontinence or even queefing, things that happen that are normal bodily functions, like how do we begin to normalize this for people?
I love that you mentioned queefing because I just had a whole podcast episode called The Queef Revolution where we just talked about queefing the
I
whole time.
love that. I have to
Uh,
listen to that one.
yeah, it's fun. Yeah, this is part of what I've realized we have to do as pelvic floor therapists. Part of our job is educating and treating conditions, but for almost everyone, there is something to destigmatize as well, and just let people know. Like what we hear often from patients is, sorry, this is too much information, but, and we try to tell everyone there's no such thing as too much information. Everything you're experiencing, someone else has experienced. You're not alone. This isn't something that you need to feel shame about.
Mhm.
But shame is really deep seated, and it's not something we can often treat on our own. So we work really closely with therapists and sex therapists specifically for our patient population, where depending on where someone's shame or trauma has come from, we have resources to refer them out to co-treat with pelvic floor therapy, because we are ultimately focused on the physical component of their pain, and our sessions can get pretty long and intense with manual therapy or exercise therapy based on what that patient needs. So while we are communicating often, and this is why we see our patients for an hour at a time one-on-one, we can't always break down all of those shame barriers, but we do the best we can at destigmatizing and supporting patients that way too.
Mhm. Yeah, I've done some collaboration with many pelvic floor PTs here in Michigan where it's like they're working on the physical side of it, and then we get to work in sex therapy on the psychological and the mental side of it.
Mm-hmm.
And also I mean, both of us really with the emotional side of it, that what can bring up when you're working with the body in that way. Uh,
Yeah.
and yeah, leading us into then painful sex, right? I know we've talked a little bit about this, but like so many women are experiencing painful sex and not speaking up about it, because, and I think again this is linked to that shame. It's like, and I think sometimes the messages that come through, especially in heterosexual relationships, is around pleasing the man, right? We need to keep him
Mm-hmm.
happy, especially if you bring in like religious backgrounds and upbringings into this. And so many women are suffering in silence. Again, if these at home, like, or brunch conversations are happening where friends are like, yeah, me too, right? Like, it's the thing, right? It's like, no, sex can also be and should, I try not to use the word should often, but sex should be pleasurable for you. Like that, we have points on our body that are literally on our bodies designed only for pleasure. um,
Hmm.
and so what do you, in terms of painful sex, like what is something that you wish that women knew more of when it comes to this specifically?
Oh, I love everything you just said. This is something I talk about all the time. Yeah, so painful sex, it's layered, but what we will typically start with is trying to just get to the root of where it's coming from, right? So that in and of itself can take multiple sessions with patients because you have to build a certain amount of rapport. Depending on what someone's coming in with, if it's painful sex, but it's also a trauma response, we're working with something like vaginismus. We might not even incorporate touch into sessions until we're like 2 or 3 sessions in. Typically, what we're seeing in patients that have painful sex is pelvic floor tension. So, whether that is a reflexive amount of tension or a chronic amount of tension, um, those muscles being tense can create a more painful stimulus during sex, which is counterintuitive to a lot of thinking about sex because this what we hear, as women growing up is, oh, you're so tight. That's so good. You should be tight. You should be tight. But in reality, if you're truly turned on and you're enjoying yourself, your muscles should be open and relaxed. And that should allow for easier entry, no pain, and more pleasure for women. So especially in hetero relationships, prioritizing that is going to be key. And that all comes down to communication. And that's why in queer relationships, we see much better results in terms of pleasure because communication is such a large part of queer relationships just from the jump.
Mhm.
Because this isn't something that's normalized, right? We have to communicate about pleasure and desire, and it leads to more intimate moments, really. So in our sessions, if we're working on tension, we will do a variety of manual therapy, breath work, and what I like to call a pre-sex routine is what I'll set patients up with. So it's a little, maybe 5, 6 minute routine that they can do at home that helps lengthen and expand the pelvic floor muscles and just relax the nervous system a little bit because ideally you want to be in that relaxed state to get aroused.
Mhm. Yeah. And that kind of leads us into like pelvic floor and Kegel exercises. And there's, I know, some truth and some controversy against this. In the terms of like so many people, like I tell my mom, like, oh, I'm peeing when I sneeze. Oh, you need to do Kegels. You need to, right? You need to do Kegels. You need to use the Benoit balls, like things like that. And what I've learned over time is that that is not always the answer. And that's, I think, what you're getting here. It's like sometimes it is that the pelvic floor is actually too tight, not necessarily weak. So can you, yeah, like what do we need to know in that regard? And I get often asked too by clients, like, how do I know? Like, how do I know if it's too tight versus how do I know if it's not tight enough?
Yeah, there are indications of a tight pelvic floor that you can look for symptom wise. The best way to know is through an assessment because sometimes like there are symptoms where you could have pelvic floor tension and weakness, and actually they can coexist. So Kegels are a buzzword, and then they were fought against by pelvic floor PTs for probably the last 5 years. And there are some clinicians that are like, absolutely no Kegels. And I'm somewhere in the middle. Kegels are not the answer in most cases. In most cases, I'm seeing too much tension to incorporate Kegels, but there is a time and a place for them. And a Kegel done effectively, which is just a pelvic floor contraction, an isolated pelvic floor contraction, right? It can teach you how to engage and relax those muscles by incorporating that movement. So my biggest piece of advice is when you go on TikTok and you scroll and that person is like, okay, go Kegel, 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 don't listen to that because you probably don't need them. I don't advise people to do Kegels unless they are specifically prescribed them by a pelvic floor PT or someone who's doing an internal assessment and can really get that feedback. Because the other piece of Kegels is that not everyone does them correctly, and coordination is a big part of what can play into pelvic floor dysfunction, especially leaking, which is what you mentioned. So we will sometimes use pelvic floor contractions to treat stress incontinence or leaking with sneezing, But if someone is doing it incorrectly and actually bearing down, they could be making that condition worse
Mhm.
and they could be contributing to more tension. So there's a fine line. It's a tool that we use. It's one of our tools as pelvic floor PTs, but it is something that we often have to educate on a lot so that patients aren't overdoing Kegels.
Yeah. Yeah, that was something. So I had been in the sex toy distribution world for almost 12 years now, and Kegel balls are something that we would sell. And so for so long, years, literally, I'm talking about Kegels at parties and whatnot when I'm with women and in those intimate spaces. And in my presentation, I'd be like, okay, everybody, right? Like, bring your imagine that you're bringing your vagina into your butthole, right? Like that is what you're doing. Like that is the stretch. That's how I would kind of communicate it. And then again, in podcasting and having professionals and pelvic floor PTs more in my world, I'm like, oh, okay, I need to stop doing that. And and then I learned the breath work component of it, right? Like if I'm just sitting here and I'm just like rooted, like I'm kegling right now as we're talking, like if I'm just
Mhm.
doing that, right? Like, but I'm not incorporating the breath work with it, I'm not incorporating the mindfulness around it, it's not going to be as impactful. And as what you're saying too, it's like that might not be what my body needs or what my pelvic floor needs right now.
Totally. And some pelvic floors, even with like a stress incontinence, which is something that typically is indicative of weakness, might get better with just a breath exercise because it was tension and they didn't need Kegels at all. So
Mm-hmm.
that's where it's hard because not everyone has access to a professional assessment and people want to, self-diagnose and try things at home. So sometimes it can be a matter of trial and error, but just really tuning into how your body's responding to these things can be important.
Yeah. Yeah, and I'm a big proponent now, like getting more into somatic work recently, like really just leaning into your body. Like I have clients and women, and if for anybody's listening to this right now, definitely a tip, like just place your hands over your pelvic floor, over your vulva specifically, and just sit with her. Like just be and see what's coming up. Like our bodies are geniuses. They will tell us what we need. And I think so often we're reaching for those outside resources. I think having collaboration with pelvic floor PT is definitely a healthy, like holistic approach to go to, but it's like there isn't going to be a magic pill around this. There, you don't necessarily need devices, right, to assist with this. Like we have so many tools within ourselves that we can really utilize for things like this.
Hmm. Yeah, absolutely. And getting patients comfortable with the idea of touching their own bodies sometimes is a whole nother thing that we treat. And sometimes we'll start with a mirror. The amount of patients I see that have never visualized their own anatomy and have fear around that it's not surprising to me just based on the world I grew up in. I get why that happens, but it is something that we utilize a lot because that can be a really big tool when people are like, okay, this is part of me and it can tell me things. So I love that you mentioned somatic work. That's great.
Yeah. Yeah. That mirror exercise can definitely be very impactful too. It's like, oh, that's my clitoris. That's what it looks like. Or, oh, this is actually where I pee from. Like, who knew?
Totally.
And yeah, I think that again, there's so much empowerment behind that because if we don't know our bodies, how are we to communicate to another person, right? And especially a sexual partner. And you brought
Hmm.
up that vaginismus too. Like I know vaginismus comes back to feeling safe in the body and trusting and things like that. And so when those, we have a whole separate podcast all on vaginismus. If anybody's interested, we can link it in the show notes because I know I have many more things I want to get into with you
Hmm.
here today. But anyways, like you're working with people again to really create that safety within themselves to where it's feeling more inviting to bring in another person.
Yeah, absolutely.
So let's move into dating. So somebody that is dating with pelvic floor disorder, obviously can bring up some pretty unique challenges, given that you might not know this person or have history with this person. So what advice do you have for people that are navigating intimacy while they're managing these symptoms of pelvic floor disorder?
This is such a tricky one. It's something I'm actively working on in my own practice
Mhm.
and fine-tuning to each individual person because everyone has a different anxiety around it, right? And it depends what condition they're dealing with dating. Most often, I hear that leaking is a big hindrance in terms of communication because people feel embarrassed around it. So it's a matter of, being prepared what they should or shouldn't drink on a date to make their symptoms worse. There can be a lot of like behavioral education around that. And ultimately, the best piece of advice is communication, which is the hardest piece for a lot of people, especially when they're dating someone new. So for these patients, I I like to make sure that they are, not make sure, I like to recommend that they are seeing an individual mental health therapist as well, because the combination of tools that you can get from working on your own self-confidence, self-esteem,
Mhm.
communication techniques, and then what we can provide is a lot of behavioral stuff. So if it's pain with sex that this person's worried about, what can we do while you're dating that will reduce that as much as possible? And it's going to be a version of that pre-sex routine, but it's not going to be as maybe as lengthy or as planned out, as sure of where you'll be as you
Mhm.
would be in your own home with a long-term partner.
Yeah.
So we can figure out something that works for that person's lifestyle. And if it is leaking, how can we keep them prepped? We don't like to recommend pads too often, but there is a time and a place for those as well. That's a tool we can use. So what is going to make that person feel more secure on that date to help establish rapport with a new person to then be able to communicate with them?
Yeah.
That's kind of where I've landed so far, but the advice varies based on the person too.
Yeah, and I'm glad that you said this because I truly believe like dating in itself, let alone whether or not you're having pelvic floor dysfunction, like is it's not a one size fits all, right? For different people. And so yeah, I'm glad that you acknowledge that like different people are going to have different struggles. And again, accompanying this with mental health therapy or counseling, whatever it is, just having somebody that you can speak freely to and navigate these different things that are coming up for you is going to be helpful. Um,
Yeah.
and two, like normalizing also, you could be dating at any age. And with pelvic floor, right, there's different life stages that you have in the different body shifts that we have. So somebody that is pregnant or postpartum or perimenopause, um, can you speak a little bit too around maybe some shifts that women would notice during these different life stages? Um, yeah, we'll leave it at that. Different shifts that they.
Sure. Yeah, pelvic floor wise, we have some pretty big shifts with the stages you mentioned. So during pregnancy, for example, there's an automatic change in the way your pelvic floor supports your anatomy because you have a growing fetus and your deep core stabilizers are typically part of the equation when it comes to creating stability and support. But during pregnancy, those are being lengthened and expanded and weakened automatically. So your pelvic floor has to work overtime to create that stability. So what we're going to see in almost every single pregnant patient is a increase in pelvic floor tension. So in those patients, a lot of pregnant people will come into my office and say, I've been doing my Kegels, don't worry, I've been strengthening. And this is an example of where I'm going to say, hey, unless you have a specific symptom, I'm going to advise against Kegels during pregnancy because we are creating tension and we need to. That tension is healthy. But in terms of delivery and birth prep, we're going to work on lengthening and relaxing because that's what's going to help deliver a baby. So during pregnancy, we see those kind of changes. We also see an increase in the hormone relaxin, which can create some elasticity in the ligaments and muscles, and or sorry, what word am I looking for? Lengthening, a little bit more weakness, and that can actually contribute to dysfunction as well. So it doesn't necessarily have to, but we see that peak in the second trimester, and that's when symptoms of incontinence can pop up. So we are looking at different things that happens to the pelvic floor during pregnancy in pelvic floor therapy. Now, looking at perimenopause, we're dealing with some different shifts. So we have hormonal shifts that are primarily a reduction in the body's estrogen. And in some people, this can be reduced by up to 90% during menopause. So estrogen is going to contribute to tissue elasticity and function. So when we assess pelvic floors around perimenopause or postmenopause, we're seeing differences in that tissue quality and that tissue's ability to contract, relax, do all the things the pelvic floor needs to do to function really well. So it's not to say you can't live without dysfunction, but it might take some intentional training and effort to get the pelvic floor where you want it to be at that point. And I think this is a really common place that we hear people talking about, oh, well, I went through menopause, so now I leak a little bit and that's fine. And it is fine, but we could help it potentially. So it's worth, getting an assessment and seeing what we can do about it too.
Mhm. Yeah, I'm really in the camp of like if it's bothering you enough, if it's inconvenient in your life, it's worth looking into, right? And even
Mhm.
if you've been told like, oh, this is normal, this is common, like get used to it. right? Like ask yourself, are you willing to stand for that? Like, are you willing to just settle for that to be, the rest of your life essentially? And some people, yeah, like that's and no shame around that. Like some people you just might be like, yeah, okay, like it happens. It's pretty infrequent. It's fine. It's not causing that big of a deal in my life. And for others, they're going to be on the opposite end of that. And so, yeah, I think
Hmm.
again, yeah, and I know pelvic floor PT specifically is something that is really growing. I'm located in Michigan, kind of just outside Detroit, so not too far from Chicago. And many pelvic floor PTs I've had have been more like West Coast people. So you're the closest I think that I've had on the show so far, which is nice. But what if somebody was looking for a pelvic floor physical therapist? Is there like a website or directory or anything that they could go to find somebody local to them?
That's a good question. I believe Herman and Wallace has a directory of PRPC practitioners, which are pelvic floor therapists who have received their full certification. So you could find someone there. It won't show you every clinic because not you don't need that full certification to treat pelvic floor,
Mhm.
but that's a good registry. I think as of right now, that's the only one. There might be another one that I'm blanking on, but that's a good way to do it. Unfortunately, it is something that's more common in bigger cities right now. Even in Chicago, I think we're the third or fourth specialty clinic that
Mhm.
opened, and it's a pretty large city. So I part of what I want to do with the Public Institute is have an online component so, people out of state can at least have some resources. And I think that's what's amazing about podcasting is we can educate from afar. So I'm really happy that I stumbled upon your podcast because this is awesome what you're doing.
Yeah.
Uh, but yeah, it's a hard one. I want there to be more public work PTs, but at the same time, they're hard to come by.
Yeah. Well, thank you. Yeah, literally so much for what you're doing. I know you're really making an impact in everyone, again, client wise or personal wise that I know that has seen a pelvic floor PT has a good story behind it. Like definitely has noticed some progress. And I think too, also what I've heard is like it's not something necessarily that's going to be long term. I've heard a lot of people, it's like I was able to do 6 sessions, and then in those sessions, they're taught the techniques that they can then do at home. And so um, I think that's also great, right? Because I know a lot of times health insurance isn't covering something like this. And so it can be pricey for people that are having to pay out of pocket. But again, if you're knowing going into it, it's like, okay, if I can get these tools under my belt and then actually use them and utilize them on my own, that is going to make that more long lasting for them in terms of the progress that they're going to see.
Absolutely. Making our patients self-sufficient is the main goal so that they can have one be empowered to really tackle this stuff on their own because that's a huge part of it. It's confidence, it's feeling like they're in control of their bodies and they know what's going on, right? So I don't want to be seeing someone once a week for the next 3 years, ideally. It's nice to have your pelvic floor PT that, like, oh, something pops up, I can go back and get reassessed for a new thing. But ideally, we don't want to see people forever.
Yeah. And that's kind of going back to those life stages, right? Like I might see you during pregnancy, and then after pregnancy, maybe something else is coming up, and then maybe I'm hitting perimenopause. And so I'm like, hey, I got these new things, right? And like you're there, you're going to be there. Pelvic floor PTs are going to be there for those different changes and know about it, right? And I think in just general Western medicine, often when a woman is bringing up an issue of painful sex, they're being told, like, oh, just relax more. Oh, have a glass of wine, right? And it's like, fuck that. It's not,
Yeah,
that is not a substantial answer.
no, that is not real. Do you follow the pelvic people on Instagram?
Uh, it doesn't ring a bell.
They have like vaginal care products that they're also owned by pelvic floor PTs. So their main thing is pain with sex.
Yeah.
And they post memes about this all the time. It just reminded me. And it's like, just have a glass of wine. No, like that is so not what we're doing. We're not doing that anymore. Can we stop saying that?
Yes, please.
It's
I'll
wild.
give them a follow because I love following different social media accounts like that. Amanda Fisher is who I've had on the show several times. She's in
Mhm.
St. Louis, so Empower Your Pelvis is her practice, and
Mhm.
yeah, her reels also are hilarious and just relatable. And I think that draws people in, and it gets them actually listening and planting that seed of like, oh, this makes sense. This is what I'm experiencing.
Mhm. Absolutely.
Yeah. So I'd love to bring in we've been talking about embodiment and how this is such an impactful part of the healing process for this. Could you share some of those breathing techniques that you help with people, or maybe speak more to that 5, 6 minute like pre-sex workout that workout? I was like, not a workout, but ritual that you were speaking on.
Yeah, absolutely. Breath really is, I would say if there was one thing I could give every single one of my patients to focus on throughout the day, it would be breath.
Mhm.
Because a lot of us are breathing. I mean, it makes sense. Societally, we're stressed. We're like engaging our abs all the time. We're tense. We're breathing into our chest. And what that's going to do, that's not inherently bad. Chest breathing is totally fine. It's normal. But your pelvic floor can't really fully relax if you're taking a higher breath. So, what we teach is diaphragmatic breathing, which is actually the way babies breathe. So, if you watch a baby breathe, you'll see their belly rise and fall naturally. They don't have any stress, they don't have a worry in the world. It's great. Their pelvic floors are relaxed. So, we are teaching our patients to breathe this way because it actually helps it basically forces the pelvic floor to lengthen and relax. Because what happens when you take a diaphragmatic breath? Your diaphragm is shaped like a dome at the base of the rib cage. And when it engages, it actually flattens. So if you think about how I like to cue it is think about swallowing a deflated beach ball, and it's working its way through your intestines. And that beach ball starts to inflate on its own. It's going to have to pull air in nice and low. So you're not forcing that air in, but you're just letting your belly kind of expand as you breathe in. That's going to get the diaphragm contracting, which will flatten it. And that pushes the abdominal contents a bit lower. So with that, the pelvic floor has to lengthen and relax to make room for that movement. So diaphragmatic breath really is the basis of what we teach. And with that breathing, we can also teach activation because from a lengthened state, we're going to get a better pelvic floor contraction. So we're teaching that inhale, lengthen, contract on your exhale because you'll be able to actually engage those muscles a little bit better. So for the pre-sex routine, we're starting with just quiet breathing, breath work, getting everything lengthened and relaxed. And then for patients with painful intimacy, I would incorporate a stretch into that. So you can apply diaphragmatic breathing to any pelvic floor lengthening positions. So we have butterfly pose, modified happy baby, child's pose, frog stretch. There's a few different stretches we would give a patient based on what they're coming in for. Sometimes it's just an abdominal stretch or a low back stretch too that can help them. And applying that diaphragmatic breath to it just gives even more length in those tissues. So my pre-sex routine is a combination of quiet breathing and maybe one or two poses typically. And in a pose, I really recommend sitting in that for at least a minute or two.
Mhm. Yeah. Yeah. And is this something that you would have them do solo, or is this something that you'd have their partners join in on or be present for?
It would be awesome if their partner joined them too. But either way, so if patients are more comfortable solo, just working, this is their quiet work on their own, and then they want to engage with their partner, totally fine. If their partner is open to doing it with them, it's
Mhm.
probably a really good sign that that patient feels comfortable communicating with that partner too. So I don't think there's any harm in that with the partner involved.
Yeah, I would agree for sure.
Mhm.
Well, thank you so much. This has been just a wonderful conversation. I know we've talked about so many different things, so I imagine this is
Yeah.
a really good resource for people moving forward. But as we're wrapping up here, I'd love to just kind of end with some practical wisdom. So, what would you say are 5 things that you would recommend people stop doing right now to take better care of their pelvic floor?
Oh my gosh, 5 things. Okay. Uh, don't do TikTok Kegels.
Yeah.
That's number one. We already talked about that. Uh, don't just in case pee. So that's when you have to go somewhere. It's a 15-minute drive, and you're like, oh, I'll just run to the bathroom really quick because I might have to go. If you don't have to go to the bathroom, that can start to train poor bladder habits because your bladder is a trainable muscle. So when people experience urgency every 15 minutes, that's something we can actually train and untrain. So we say don't just in case pee because you can train it in the wrong direction. So only go to the bathroom when you have to.
Mhm.
Don't poop without a squatty potty or a stool. The squatty potty is my number one recommended tool, and it's I won't poop without it. I don't recommend it. We can go into that could be a whole hour conversation if we wanted it to be. uh, don't skip out on hydration. So even if you're having a lot of liquid throughout the day, making sure you're incorporating water. And we all enjoy bladder irritants, coffee, tea, alcohol. We like having fun, we like living our lives, but incorporating sips of water in between those can really help support a healthy bladder. Um, and I mean, the last one I would say is don't think you're in it alone. I know that that's easier said than done, but you're not alone. And a lot of people experience these conditions and symptoms, and we're here to support. This is what we're doing, and we're going to keep destigmatizing and making progress in this direction.
Yes. Thank you so much again for coming on. And how can
Yeah,
find you and the Public Institute if they want to connect with you?
absolutely. My Instagram handle, my social media handle is Amanda Neri PT. My last name is spelled Neri. And from there, there's links to my clinic and my podcast as well.
Awesome. Thank you so much
Yeah.
for coming on the show today. It's been really great talking with you.
Yeah. Thanks for having me. This has been awesome.
Thank you so much for listening to today's show. If you loved it, be sure to subscribe so that you never miss an episode. And if you really fucking loved it, make sure to tag me on social media at the Rachel Main. I'll see you next week.